My name is Caitlin Caplet. This is Brian Smith. I'm recording this video for NU 650 Advanced Health Assessment, the cardiac and peripheral vascular system. Brian, do you give consent to record this video?
Yes.
Okay, I'm going to start off. Just relax your head. Turn this way for me a little bit. Good. And the other way. Good. I'm not noticing any jugular vein distension. Keep your head turned this way for me a little bit. I am now finding the maximal point of auscultation to measure jugular venous pressure. I'm going to line the index card up there and take a ruler and line the ruler up with his sternum. And line up the 90-degree horizontal angle. It's at 2 centimeters, so I would add 5 centimeters to make it 7 centimeters. Okay, next I'm going to auscultate the carotid pulsations to listen for any bruits or whooshing sounds. Take a deep breath in and hold it. Good. And turn the other way. Deep breath in and hold again. Good. I'm now going to palpate the carotid pulses one at a time. Good. It is 2+. Other side. This side is also 2+. They're symmetrical. It's going to palpate the interior chest to look for any heaves, thrills, lifts, crepitus, or tenderness. So I'm going to start with the palmar portion of my fingertips, palpating the second intercostal space, right sternal border, or aortic area. And then the pulmonic area, the Erb's point, the tricuspid, and the mitral or apex. Good. And if there was any lifts, I would feel my hand lift up. Now I'm going to switch to the ball of my hand to feel for any thrills, which would feel like a buzzing or whooshing sensation. Good. Okay. I'm now going to locate the point of maximal impulse. Good. And it is in the 5th intercostal space, mid-clavicular line. It has a normal amplitude and duration. I'm now going to listen with both my diaphragm and the bell at all of these 6 points. Take a deep breath in for me. And in the pulmonic area, in the second intercostal space, second left intercostal space, you could hear the splitting of S2 when he held his breath. Good. And I hear S2 louder than S1 in the aortic and pulmonic areas, and then as I move down, the S2 begins to get softer. I'm now going to listen with the bell of my stethoscope. Good. And no murmurs or aortic regurgitation or stenosis were noted. I'm now going to listen for mitral stenosis particularly. Turn your head this way a little bit. Good. Lean forward a little bit. Good. Turn your whole body a little bit to the side this way. Good, perfect, just like that. This is the left lateral decumbent position. I'm at the point of maximal impulse. And I'm hearing S1 and S2 with normal duration and amplitude, no splitting or signs of stenosis. All right, you can turn back. For aortic regurgitation, I want you to sit up for me and lean slightly forward. Good, and then I'm gonna have you take a deep breath in and exhale, and when you exhale, hold your breath after. Go ahead. And exhale and hold. Good. There is no presence of any murmurs. I was listening down the left sternal border to the apex. I'm next going to inspect his upper extremities. Hold your arms out for me. Good. Any tenderness?
No.
His skin is pink. There's no lesions or discoloration. Turn your arms this way. Good. His arms are warm. They're symmetrical. His hair is evenly distributed. His fingers have good capillary refill. Okay. Now I'm going to palpate his brachial and radial pulses. Good. Good. Both radial pulses are 2+ and symmetrical. Good. Both brachial pulses are 2+ and symmetrical. Now I want you to close your hand and make a fist and squeeze as tight as you can. Turn your hand towards me a little bit. Good. Good. Now slowly open your hand. Good. And his Allen test was normal. Color returned to his hand within about 1 second from releasing the ulnar. Inspecting his lower extremities. Good. There's no pitting edema. Is there any tenderness when I'm touching you?
No.
Both legs are warm, symmetrical, no swelling or edema. The hair distribution is normal. Cap refill to the toes is less than 3 seconds. There's no noticeable varicose veins or any signs of insufficiency. All right. And the color of the skin is pink. I'm now going to palpate his femoral pulse. Just move your hands for a second. Good. Femoral pulse is 2+. I'm now going to palpate the popliteal. Good. 2+. Now the dorsalis pedis. Also 2+. And lastly, the posterior tibial. Move your foot a little bit. Right behind the ankle.